We're ready to roll here. Well, good morning. I'm Lee Pfluger, president of the Manatee County League of Women Voters, and on behalf of the League, I welcome each of you to joining us today. We have, speak louder, higher, somebody's signaling. Louder? Okay, great. We're glad to have you all with us today. We're especially happy to have some excellent speakers today who will help to further inform and probably to remind many of us also of this important issue that's being addressed today. First, I'd like to recognize some public officials who are with us today. Robin Sabatino, glad to have you with us. And John Chappie, where are you? Larry Bussell. And our school board leader, Karen Carpenter. Thanks for coming. We really appreciate your presence in these meetings. You have a lot to contribute, and when it comes to question time, so often you are a resource as well as having very informed questions. Today we will talk about a very important subject for our county and state. And that, of course, is indigent health care. Many Floridians do not have health insurance, as all of you know, and cannot afford to get it. They're falling through the cracks in the current system, as well as the Affordable Care Act. So I'm not telling you all anything new, but we're really glad to have a chance to present this program today. Florida has rejected the expansion of Medicaid, and the voters in Manatee County have rejected a sales tax increase to help fund indigent care. Today, our guests will talk about what our needs are, what we are doing to meet them now, and how we will fund them in the near future. We are pleased to have with us today two professionals who have had long careers in health program management in Florida, Dr. Jennifer Bensi, who is the administrator of the Florida Department of Health in Manatee County, as well as the head of the Manatee Health Alliance. Can everybody hear me now, especially now that I'm introducing? Okay. We also have with us Chuck Henry. I asked if he wanted to be introduced as Charles or Chuck, and he said Chuck, so Chuck Henry, who is Jennifer's Department of Health counterpart for Sarasota County, as well as the director of Sarasota County Health and Human Services. And to tell us more about the financial challenges facing our local governments, we welcome to our panel as well Ed Hunsiger, the Manatee County Administrator. We thank you for your time with us today. The speakers are planning to present for about 10 minutes, and then there will be time for questions after they're finished speaking. We would be grateful if, when it comes time to have questions, that in fact you do ask questions, and we will time about 2 to 3 minutes for those questions. We hope that will be plenty of time for you to address the kind of information that you'll be interested in hearing. Okay, and now, Jennifer, would you like to begin? We thank you.
Pleasure. Thank you so much for the invitation to be here today, and thank you audience members for joining us. Just to give you some background regarding the Florida Department of Health, our role is to provide core public health services in the counties and assure an integrated healthcare system. Other functions include monitoring the environment for health concerns from the beaches to mosquito carrying disease, investigating disease outbreaks from foodborne illness to tuberculosis, immunizations for children and adults, assuring the healthcare system is quickly functioning after a disaster, such as a hurricane or tornado, and to promote prevention through education and screening activities. Our overarching vision for the Florida Department of Health is to be the healthiest state in the nation. A few years ago, the Robert Wood Johnson Foundation started ranking counties across the country in terms of their health. And for the last 3 years, Manatee County has been in the low 20s out of 67 counties. So that's okay, but we could do better. The leading causes of death in our county include heart disease, cancer, chronic respiratory disease, stroke, and motor vehicle accidents. The goal in my role is to have an integrated healthcare system. We're very fortunate in Manatee County. We have a lot of resources as it relates to healthcare. For example, we have 4 accredited hospitals and a new trauma center. We have Manatee County Rural Health Services. They are one of the largest federally qualified health system networks in the country, right here in Manatee County, providing primary and specialty care. We also have numerous providers through the Medical Society, primary care physicians, specialists, dentists. We need more. Fortunately, we have LECOM, Lake Erie College of Osteopathic Medicine, which is providing medical students, dental students, pharmacy students in our community. And now we have residency programs at most of the hospitals here in the community as well, hoping to keep them here for their formal training and then hopefully staying and raising their families here as well as practicing. We also have numerous schools of nursing, for example, and other programs at University of South Florida, Manatee Sarasota campus, State College of Florida, MTI, and Kaiser University. We also have Turning Point, which is the clinic, which is now also being run daily by the residents of Manatee Memorial Hospital, those in family practice and internal medicine, a wonderful resource. We have We Care, which is the physician volunteer program here in the county. We have an excellent EMS system. They work very closely with the hospitals to improve outcomes. And the Chamber of Commerce, a very strong healthcare committee that has been working to promote worksite wellness programs in businesses throughout the county. Challenges: assuring that there is access for all residents, especially those who are under or non-insured, which is approximately 24% of our population in Manatee County. What are some of the opportunities that we're looking at in terms of improving the integrated system? For example, the Manatee Healthcare Alliance has over 50 healthcare partners in the last 2 years coming together to look at these issues and decide how we can improve the system. We are looking at health information exchanges, for example. That's the data that everyone is using for patient information. That will streamline the process. You won't have to duplicate the paperwork every time you go to the doctor. They'll know what tests you've already had, so they won't spend money and inconvenience you, for example, by having more tests taken. So that is a pilot project, for example, that's being done in the hospitals, and also Manatee Diagnostic Center is doing a unique project as well. Case management through technology, we really say, is the key to the future. Once a patient, diabetic, somebody with chronic obstructive pulmonary disease goes into the emergency room, they have someone following them after they leave to help them monitor their care outside the emergency room, so hopefully they don't get into a crisis situation and have to go back. Again, technology plays a key role in this. There's a lot of ways that you can monitor your blood sugars every day, your weight, different diagnostic indicators that can be used from the home, and that way hopefully the person doesn't even have to go to the doctor or the emergency room. There's also programs such as paramedics visiting homes to assist with those who potentially could be at risk for falling. That's a huge issue in every community across the country. We already have good programs with EMS regarding drowning prevention, education, fire and smoke detectors, and carbon monoxide detectors, but also dealing with, again, medical issues such as diabetes and helping monitor people in their homes. The school system here in Manatee County is the largest employer with over 5,000 employees, so worksite wellness is extremely important. We have a program with them, and we're continuing to expand that as well, because if we can keep the teachers healthy and the staff, that obviously helps the children in their teaching and learning capabilities. Youth also in the schools during the day. We know their top priority is education, but pediatric obesity is a crisis in this country. It's an epidemic. And how can we utilize their time in school, whether it's what they're eating or what they're physically doing, to assist in this obesity epidemic? And finally, our county government. We have a tremendous partnership in this community with the county supporting healthcare. Mr. Hunzinger obviously will tell you more detail about that. But for example, their wellness program for their employees is actually a model in the country. So they really support initiatives. A built environment is another example where they are focusing on improving the opportunities for people to walk, ride bikes, et cetera, in the community. So just a tremendous role model for what they are doing in county government as it relates to healthcare in Manatee County. And I'll stop there.
Well, good afternoon. Again, Chuck Henry with Sarasota County Health and Human Services, and I have the unique opportunity in Sarasota as serving both as the County Health and Human Services Director and the Florida Department of Health and Sarasota Administrator. I say unique because it provides an opportunity to put together so many of those factors that impact health in our community under one umbrella so that we can make sure we have alignment as we move forward. One of the things I really want to start out with is saying that these, especially when it comes to indigent health care and the health care issues that are the topic today, they certainly don't stop at county lines, and there's certainly no border. And so we share those same concerns and those same struggles regionally. I work closely with Manatee County and with Jennifer on any opportunity we have to serve our communities in a better way. And while people always like to look at how does Manatee compare to Sarasota or Sarasota to Manatee, we're really more similar than you might imagine. As Jennifer stated with the Florida Department of Health in Sarasota, we have a mission to provide core public health services to our community, and those include the environmental health, the epidemiology, the disease control, the health promotion type activities that you, at least as health professionals, we think of as the core public health functions. Wrapped into one of those functions is an effort to connect individuals to needed services, and that includes primary care services, which specifically speaks to indigent health care. Again, and the processes are very similar between counties. And Sarasota County, we're fortunate in that we have a federally qualified health center, which is exactly the same thing that Manatee Rural Health is, a federally qualified health center. The difference is in Sarasota, that's under the umbrella of the health department and operated by the health department. But essentially, they serve the same function in the community as the principal primary care safety net providers for our communities. So we have that function with us as the County Human Services Manager. I also have County Human Services, County Veteran Services, and County Mosquito Management, which all tie again into assuring good health in our community. But it's really just a close relationship and an opportunity to work together within our county. But the similar process occurs here in Manatee. I know for certain because we talk all the time on mosquito-borne illnesses, on disease control, on access to health care and how to refer individuals from our communities to the appropriate service. As a federal qualified health center, we don't really have any recognition of borders. If Manatee County residents seek services in our facilities, they're the same as any other Sarasota County resident, and I think vice versa with Manatee Rural Health as a federally qualified health center, and that's just one of the federal requirements of receiving some federal funds to help support that. All of us struggle to care for the uninsured and underinsured in our communities. And with the changing landscape in healthcare over the last 5 years that is still evolving, you know, when I look out at my budgets in the year to come and recognize that my federally qualified health centers account for about 50% of my overall health and human services budget, it's on one hand a little troubling to not know exactly what that funding looks like, because in the healthcare reimbursement arena, Medicaid is changing from cost-based reimbursement to managed care, and To make matters more challenging for us, there is a regional line that the state has set up in terms of healthcare regions that does have a border between Sarasota and Manatee. And so in my region, we're moving to Medicaid managed care in June of 2014, and I don't know if I have the date for Manatee. It may be the same or it may be different, but that's going to pose some challenges for us. And even a greater challenge is that the healthcare providers, the HMOs that our clients from our community are being assigned to, some are the same, but there are some differences. There's some HMOs that won contracts for this region and that Manatee's a part of that didn't win the contracts for Sarasota, and vice versa. So it's going to confuse some of our clients that travel back and forth. But nonetheless, our challenge is to try to serve as many clients as we can with the highest quality medical care possible, and do it as cost effectively as possible, because all of our work is supported through client fees, through county contributions, through federal contributions. And so as you might imagine, the dollars are not flush, and you have to carefully manage the services you provide and ensure that you're trying to reach the most people with the highest quality care possible. In Sarasota, we have 4 regional hospitals, and we're very fortunate there. One of those is Sarasota Memorial, which is a locally funded not-for-profit hospital, I think one of the largest in the state in that status. And they are the principal safety net provider for indigent care on the hospitalization side and specialty care side through their volunteer community health clinics. So we work very closely with them in terms of referring our primary care clients that require specialty care. And we also have Senior Friendship Center, which works with volunteer physicians much in the same way that the We Care program in Manatee does, under the Senior Friendship umbrella, to provide that safety net care to our seniors. So between the 3 of us, Sarasota Memorial, our Federally Qualified Health Center under the Health Department umbrella, and Senior Friendship, we function as the safety net provider in Sarasota County, and essentially work through the same struggles that you do in Manatee, between Manatee Rural Health and your hospital system. And I think I'll leave it there and be happy to answer questions.
Good afternoon. Thank you for the opportunity to visit with you today. My challenge is to talk about the money side of all this. The county looks at healthcare not just at the indigent healthcare, but we started about 5 years ago looking at the healthcare industry in Manatee County. We funded a study. In fact, the Board of County Commissioners provided the Chamber Foundation some funding, and the Chamber Foundation contracted with the University of South Florida to conduct a study of the healthcare industry in Manatee County to answer a couple of simple questions that led to where we are today. First question was, do we have a problem in the healthcare industry in Manatee County? The answer to that was yes. Second question got a little more complicated. Is that problem different than the other 66 counties in the state of Florida? The answer to that was also yes. If it had been no, then the issue would have been broader than we could deal with. It was a statewide problem. But the answer was yes. It was a local problem. That started the research, and the research concluded a number of items. I think the report is still out on the website, manateehealth.com. You could go read that report from 5 years ago. But one of the big issues in that report was we were losing providers as a community. Now that hurts in a whole lot of ways. So it wasn't what we were looking at as an indigent healthcare problem, it was a provider problem. Because if your provider also treats indigents and is not being compensated, your provider might go somewhere else where they would be compensated. And then the next time you went to your provider and they weren't there, then you would have a healthcare crisis. So we started looking at ways to solve the problem of providers because we need to keep them in the community. It's an economic development tool. Who's going to move a business to a community that has a struggling healthcare industry? And the chamber is very interested because the chamber is interested in all industries, the agricultural industry, the tourism industry, the medical industry. So that's, we started by working with Manatee Memorial and putting a residency program together because it was determined that physicians will stay in the community more often than not that they do their residency in. So it's a bigger problem than just indigent health care. But altogether in Manatee County, we spend about $24 million on health care issues. Part of that comes from property taxes, and part of it comes from what's known as the corpus, which is the sale of Manatee Memorial Hospital roughly 30 years ago now. The big issues that we spend that $24 million on are Medicaid match, that's a big number. Jail medical, for the people at the jail, we're required to provide their medical services. And we support the medical community for those services they provide that are uncompensated. Years ago, that number was smaller, but things happen in the economy. We used to pay for all of that service out of that sale of the hospital. Some people thought that proceeds should last forever, and it lasted for quite a while, but that's when interest rates were high and the fund was earning a lot of money, and the demand for covering cost of unpaid, uncompensated services was low. And when the economy did the flip in the last 7 years, interest rates went real low, and it wasn't earning much money, and the cost, well, it went through the roof. So that fund will be depleted in 15 and totally gone by 16, fiscal year 15 and 16. And the question is, what do we replace it with, if anything? And that's roughly about $9 million of the $24 million was coming from that fund. And that'll be the dilemma that was be faced by the Board of County Commissioners in the coming years. What do we do to replace that? Or not? I mean, we could just not fund that portion of health care and see what happens in the medical community. Or we could cut service to the community in other areas. Nobody likes to see much of that. Close some libraries or close parks or cut back an ambulance or the sheriff. And, you start getting into those things and cutting the budget. And we've already, since the downturn in the economy, taken out 25% of the government. We've already cut back libraries as much as we think are appropriate. We've pretty well whittled away at everything that's we could whittle away at. We get down to some pretty serious cutting the next go-around. Raise revenues. Golly, nobody likes to hear about that one. So it'll really be a conundrum in the coming years to talk to the Board of County Commissioners about what do we do. But that's the challenge. It'll be roughly $9 million, and it'll face the healthcare industry. And there's no easy solution to any of that. We found out, or next time you go to your provider, you might want to ask them if they're accepting any new patients, because by and large what we're hearing is they're not taking any new patients. And if they're not, and we continue to get growth in the population, where are those people going to get their health care? We need to attract providers. We are at a disadvantage because our Medicaid and Medicare rates are lower than surrounding areas in the state of Florida. As a provider, you can go elsewhere and work same number of hours and be compensated higher. It's a tough one for us. And some people look at physicians and say, well, they make an awful lot of money anyway. Why worry about them? Well, You'll worry about them when you need to go to the doctor and there isn't one. That's when you worry about them. So it's a issue for the industry more than just an indigent healthcare issue. And it's something, as a community, we need to face up to. It's a healthcare industry issue. It's a hospital issue, it's a provider issue, and it's something we need to work together to figure out. And I'll stop there. Thank you.
Thanks so much. I think it's time now for questions. If you all would make sure that you get over to the microphone and ask your questions. Previously, that microphone did not, nobody could hear in the audience what was being spoken into the microphone, but that has been corrected. METV Now, yes, METV Now has set up provisions so that everybody can hear the questions, okay? So let's begin that. 2 to 3 minutes for your questions. Rosalie, you'll signal me when time is getting close.
Hi, I'm Rosalie Schaefer, and I'd like you to, if you could, talk a little bit more about the hospitals. We keep hearing that there's a hospital crisis as well. Hospitals are running in the red. Some of them are being sold or merged, even closed.
Well, I worked in a hospital 40 years ago, but how they're doing today, I don't know. I would hate to represent the condition of hospitals in the area. So I'll leave that one to someone else. I don't know if we have the knowledge to talk about the condition, the financial condition, or the how they operate or what keeps them in business.
I do sit on the board of Manatee Memorial Hospital, so I can give you some generalities of what's happening. But obviously, emergency room overcrowding used to be an issue, particularly when the Northerners would visit us in the winter months. Now it's a year-round issue. And again, it ties back to what's been said earlier, not enough providers taking new patients, people not having insurance, waiting too long, don't know where to go, and then finally the situation is so dire that they present to the emergency room. So that's a tremendous issue. I think everybody's looking federally what's going to be happening with the Affordable Care Act. Will it benefit the hospitals say in some ways it will, but in other ways it won't. So I think it's still too early to tell overall. I think there's the Affordable Care or Accountable Care Organizations, ACOs, you're hearing a lot about those where groups are forming entities, larger groups of individual practices, small practices can't survive. So financially they're merging with hospital groups. So you're seeing some of that going on as well. So I think it's a very interesting time dynamically in the healthcare arena. I think also the partnerships are vital. Again, going back to Manatee County, the Federally Qualified Health Center system sees the majority of the indigent care patients. They deliver over 2/3 of the babies in the community as a whole. So that partnership between rural health and the hospitals, particularly Manatee Memorial, is extremely important. And so there is a lot of discussion always going on in ways to improve the system. So just to clarify, public health in Florida, we yes, all do the same core public health functions in every health department, but then depending on the community need, things look very different. And so while Chuck oversees both a health department and a federally qualified health center in Sarasota and Manatee, rural health has for years been the federally qualified health center with over 21 locations now. The health department, in terms of seeing clients, patients, they come in only for specialty issues such as sexually transmitted diseases, family planning, or immunizations. And of course, our WIC is our largest program, Women, Infants, and Children program, plus the core functions that I mentioned earlier. So we're a very different looking health department. We don't see people for primary care in Manatee, and that was established years ago, but we do have a very strong federally qualified health center system. How do they link with the hospitals to keep people out of the emergency rooms and maintain that case management and preventive care so that people do not become in crisis? And of course that affects them dramatically, their families, but also the costs are overwhelming, and that's what we're trying to curb.
And again, I can't speak directly for the hospitals, but I know that the hospital CEOs in Sarasota that I speak with frequently are all concerned as how the Affordable Care Act is going to progress in the future, because it was based on the premise that everyone would have coverage of some type, either expanded Medicaid or access to insurance through the exchange, and therefore their indigent care numbers and costs would go down. And so if that doesn't become a reality for them, they're all scrambling, trying to figure out how do they cover those costs with reduced reimbursements that were planned based on the premise that all would have insurance, and yet the continuing burden of indigent care. So I know that's a strong concern for all of them.
Hello, Robin DeSabatino, Manatee County Commissioner. Thank you all for being here today. I had two questions from the information I heard today. Also, I was watching a program over the weekend regarding children and immunizations and their parents, like basically in California, a lot of them aren't getting their children immunized. So are we seeing that here in Manatee County? Is there an increase, decrease? Because if the children get the disease, then the older folks will get it when, we've spent years and years trying to, wipe out these diseases. So are you seeing any increase or decrease?
We occasionally see small increases. We've been able to manage the situation, but pertussis, for example, is a situation where families are choosing not to vaccinate, and that's what they had the terrible problem with in California recently regarding that type of outbreak. There are religious exemptions, and so we monitor those families in terms of their information at the school, so we know who is not choosing to immunize, and for their purpose, that's their choice. So fortunately, we've been able to not have any serious situations, and we continue to educate.
I might add to that we're very fortunate in Florida that statewide the Florida Department of Health for a number of years has had a Vaccine for Children program in place that provides free vaccines to all children. Many choose to get them from their pediatrician, which is great. But there is an opportunity for every child to get vaccines that they are required to have as children at no cost through the health department or other resources.
And my other question was, if I may, you were indicating that the surrounding counties and our states are reimbursed at a higher rate than we are. How can we change that? How can we become more competitive?
That takes legislation from the state standpoint on how they apportion out the reimbursement formulas.
You and Nicholas can work on. Thank you.
And I probably just wanted to make another comment related to reimbursement and the differences, because it gets really complex depending on whether you're talking Medicaid reimbursement, third-party reimbursement, reimbursement through HMOs. As a federally qualified health center, right now I have reimbursement on Medicaid through what's called cost-based reimbursement through the Agency for Healthcare Administration. We probably will be transitioning soon to a system called prospective payment, which relies on the federal government to calculate a floor level of reimbursement for Medicaid clients. So it's a constantly changing environment, and it's really multiple different targets you're trying to nail down in terms of what are the cost differences between regions and counties.
Hello, my name is Margaret Moore. I'm here today as a representative of the Manatee NAMI, the National Alliance on Mental Illness, and I'm also a league member. This is going to be a tough question. I'm going before our local legislators on December 4th when they have a public forum. what can I say and what can the league say as a group, or any people here in this group, to encourage our legislators to accept Medicaid expansion? Or what
We have a
approach?
great
What approach?
Okay. We hear this question a lot, and it's a very important question. I think we're very fortunate, again, in Manatee County. We have Manatee Glens as a resource, also Palm Shores through Manatee Memorial. Understanding the importance that mental illness is a disease, the percent is about 30 in terms of persons with mental illness having physical conditions as well. It's very important that we address the entire body in terms of disease. So I believe everybody advocates, understands that, and tries to. We have a substance abuse coalition in the community as well, working on issues. It's something that I think everyone knows is extremely important, and we all want to continue to improve it.
And I would add to that, and I'm very fortunate in Sarasota. I happen to chair our Behavioral Health Stakeholders Consortium, which is a community-wide group. We have, in the last 2 years, established behavioral health services within our federally qualified health center so that we're co-located. And we're also working with Coastal Behavioral Health, providing primary care services on site at their location, trying to provide that integration. That doesn't really address your question in terms of what to do. I think we all recognize just the facts that the way the system is today, those individuals that are above 138% of poverty should be able to qualify for insurance through the health insurance exchange, and may be eligible for some subsidies depending on where their income level is. Those children and young families that are at or below poverty are eligible for Medicaid already within our state. It's the adults and also the disabled adults. If their condition is such that they're disabled, and they're eligible for Medicaid. But those adults that are healthy and working but living in poverty, or adults, many with behavioral health or substance abuse issues that aren't severe enough to be labeled as disabled, really are left with no options in today's world. And that's a policy decision made by legislatures. All I can recommend is that we gather the facts on how it impacts our local areas, how it impacts our local communities, and share that with our representatives.
One other item, please. I want to compliment Sarasota that they have that wonderful drop-in center for many of the mentally ill, the Prospect House. We have a crying need for that, something like that here in Manatee County, because when we're talking about the indigents that have no health care, unfortunately, that's many of our mentally ill. Thank you.
Thank you for that. And as a compliment on the other side, we're eyeing very carefully your one-stop center for homelessness and looking at what we can do to enhance those services in our community. So it's a constant sharing back and forth.
I just have a couple of data questions. You said you identified 24% as the number of uninsured in Manatee County. Do you know how many of those actually access Manatee Rural Health Services? No idea. No. And how is Manatee Rural Health Services funded? Are they, I know they're federally qualified, so they're federal dollars. Do they also receive county dollars?
Yes. Yes, they have contracts with the county.
And the number of providers in Manatee County versus the number of providers who are actually taking indigent patients, is there a ratio there? Has that been examined? I mean, not everyone is a provider for Manatee Rural Health Services, right?
Right.
So has there been any attempt to spread the access in terms of other physicians accepting indigents? Perhaps outside of the umbrella of rural health?
Yes, that's the We Care program, and that's where we ask physicians in the community to volunteer to take uninsured, underinsured patients. Under the state of Florida, they receive what's called sovereign immunity through our office, through the Department of Health, where the liability is not an issue, because sometimes that can be a a factor in their agreeing to participate. The major issue, again, we have some providers, but when you have to refer patients, whether for cardiology or neurology, it's very difficult to have all the providers you need in the system participating in order to assist the patient. But we're working to try to continue to improve participation.
And I, again, would add to that, it's very difficult to put a number on how many providers provide indigent care, because that's a practice choice by many of our providers. Clearly, the safety net providers like Manatee Rural Health and other FQHCs accept anybody that comes through the door, but there are many providers in our community, whether through the We Care program or just because they're compassionate providers, provide a lot of service, so it's hard to get that number. I will say that your county administrator was right on the mark with one of the important issues in the community, because when I look at the Robert Wood Johnson Foundation county health rankings, they look at a lot of data. One of the things they look at is the ratio of primary care providers to population, and in that number in Manatee County for 2013 was about 1,700 to 1. In Sarasota County, it was about 1,300 to 1. And when I look at the clinical care of the other data elements, they're pretty similar for both counties except for that one. And the state rankings just in that area out of 67 counties put Manatee at 18th and Sarasota at 2. And so it really is based on number of primary care providers available to the population. I have to caution that number doesn't tell you that all of those providers accept see indigents or provide indigent care. It's just a raw number.
But all of the providers have to take Medicaid, right?
No.
They don't. That's a choice
That's
as well.
a choice as well.
Okay, thank you.
I'm Nancy Horn. Did I understand that in Sarasota in June, you're going to accept expanded Medicaid?
No, that's not correct. In
Okay.
the state, Florida statewide, our legislature has made a decision to move Medicaid reimbursement into the managed care system. In other words, assign Medicaid clients to a HMO to manage their care and hopefully reduce expenses for the state. That's a different reimbursement process for healthcare providers that do primary care than exists now. We're on what's called a cost-based reimbursement established by the state for each region. And so when it moves to managed care, we'll have to have contracts with those managed care providers in order to be a provider for them. And so it's, for those of us that are in the business of providing care, we're scrambling to try to establish contracts with those that were HMOs that were awarded contracts for our region, and making sure that we have the ability to care for our clients and refer them. And that transition happens in June of next year.
And we don't have a similar,
Yes, ours is occurring. Ours is occurring in January of this year. An example would be dental care around the state. You're seeing this as a tremendous issue, because that really has been one of the last areas where you've been able to receive cost-based reimbursement at higher rates and utilize those funds to be able to promote other services or be able to provide other services across health departments, I'm saying across the state. We don't do dental. We've never done dental in the recent years. But again, we're very fortunate that LECOM has come on board, and we hope in the next few years when their dental students can start seeing patients, that will be a tremendous asset because it is a huge problem in the community as well. We don't have enough providers. There are a few at Rural Health, and a few providers take Medicaid or see the uninsured, but not a large number. So that is something that we want to focus on. But we're seeing across the state that is a big shift right now in terms of reimbursement, and many health departments, for example, closing their dental clinics around the state because they can't afford them anymore.
so do we have a similar program that Sarasota has that he just described?
I would say they are exactly the same. The difference is the Sarasota County Federally Qualified Health Center that is under the Health Department umbrella does the same primary care work that Manatee County Rural Health Services does. They're the safety net primary care provider here. We all have to transition to a managed care reimbursement system from the state for Medicaid. It's going to happen in January for Manatee County, as I understand it. It's scheduled to happen in June for Sarasota County, but it's something that not only our 2 counties, but every county across the state will do in the next 12 months.
Thank you.
Hi, my name is Johnny Nielsen. I'm a resident of Manatee County, and I'm a freelance writer. I had a couple questions about the money. I remember the vote that they had for the sales tax, and I asked people why they didn't vote for it. And the answer I got, first of all, it was in August, so the turnout probably was pretty low. I don't know, I'm speculating. They said they didn't want to support a repressive or regressive sales tax. Anybody that knows what a regressive sales tax is, I'm sure most of you do, I guess they felt it would put too much pressure on the poor. What are the chances of you advocating for a property sales tax increase or progressive sales tax increase? Because obviously you need money to have these services.
Those are options available that the board will have a discussion next year. They haven't had any discussion about what they are going to do at this point in time, so everything's open. If I could just touch on the regressive part that was proffered during the campaign. Every other county on the west coast of Florida is at 7%. Manatee County is at 6.5%. I guess everybody else is regressive, and we're the bargain, because we would have been just where every other county is on the west coast of Florida at a 7% rate.
I think there was a lot of people that were confused as to what the money was going to be used for. They didn't understand why the hospital had run out of money. There seemed to be a lot of confusion, and I didn't get the impression that the message was necessarily clear for voters.
There's probably a lot of people with a lot of different opinions about that.
So maybe we'll see a property tax increase, or do you think that, or would you advocate for that, or do you think you can go back to the sales tax increase?
I'm not advocating anything here. I'm just reporting.
All right, thank you.
Good afternoon. My name's Dick Connard. I'm a retired physician in the community. I've got actually questions for each of you. Could I have 2 minutes per person? Mr. Henry, you're relating something very interesting to us, which is you have really 3 safety nets in handling those who are either underinsured, not insured, or indigently handled. And that is, you own the hospital as a community, you own your federally qualified health center as a community, and then there's the volunteer clinic. How much in resources of your county does the taxation dollar pay to support your federally qualified health center and your local hospital?
I don't know the answer for the local hospital off the top of my head because I have all I can do to keep up with my Health and Human Services group. I can tell you with our federally qualified health center, Health and Human Services, the health department receives about $3 million a year from the county, of which a little over half of that goes directly towards primary health care, the remainder towards public health, core public health services. So that's probably the best number I can give you in terms of the federally qualified health center. We get a little over probably $1.4 million in federal funding for our federally qualified health center. That probably the equal amount from the county that we put towards that. And then the remainder of the revenues, it takes about $15 million a year to support my federally qualified health center. The remainder of that is earned revenue through Medicaid, Medicare, or third-party insurance. And you know, I don't want to call it the trick, but the goal is to earn enough revenue to cover our indigent care and you know, because we are an open federally qualified health center, as is Manatee Rural Health, a number of our clients have no ability to pay, or they're on a sliding fee scale based on income. So the only way that we make up that difference in cost without passing it on is if we earn enough from Medicaid and Medicare and third-party insurance, which if you've been in the business as you have, sir, you know that those reimbursements are not super high, but we're able to pull that together. And Manatee Rural Health, I think, works towards that same endeavor to try to earn enough revenue to cover the cost of providing indigent care at the primary care level. The real challenge comes at specialty care. That's the most expensive care, hospitalization, and I apologize, but I'm not the expert in terms of the numbers in those areas.
But on your federally qualified health center, am I correct in taking the assumption that there's about a $3 million a year contribution through taxation in Sarasota?
If I combine federal and state?
Yeah.
Yes,
yeah.
yes, sir.
$3 million, okay, thank you. How about your obstetrical care? How is that handled in Sarasota?
We have an obstetrical practice. It's actually OB/GYN within our federally qualified health center. I have 4 board-certified physicians that run an OB practice just like any other provider would. They deliver about a quarter of the children born in Sarasota County every year. Manatee Rural Health has a much larger practice, but very similar, and we try to, as much as possible, make it look like any other practice so that we follow our clients from conception to birth and that they are delivered within the practice. All of our providers have privileges at Sarasota Memorial, and that's where the deliveries occur.
So that same $3 million includes the care for your OB/GYN?
Yes, sir, it does.
Thank you very much. Dr. Bensi, I have a question of you. At one time, correct me if I'm wrong, our health department did have physicians who saw indigent and underserved people, and that has changed operationally. As you're aware, we have over 50 physicians in the community who are retired. Is there any possibility that we could look at having a clinic in your health department run by the retired physicians?
To answer your first question, we have 1 full-time medical director, we have 2 part-time physicians and 2 part-time ARNPs to oversee our clinics, which are, again, the STD clinic, sexually transmitted diseases, family planning, and immunizations. So that is where those physicians work. In terms of retired physicians, I know through the State Department of Health, the Medical Quality Assurance Division, they monitor and provide licenses for the physicians and all healthcare providers in the state. So talking to them about how to do some type of restricted license for retirees would be wonderful asset to have, predominantly probably assisting, again, Turning Point or the clinics in the community, We Care, obviously rural health, anyone who needs them. Of course we could use them there. We have residents come through, but ours is a much smaller practice, if you will, than what rural health is providing in the community as it relates to care. But yeah, it is something. Yes, it is something that we are looking at in terms of these retired physicians who do want to spend some time working, and if they can work through the state in terms of getting that agreement where they don't have to get the full licensure, take their tests over again, all of that, but can still be providing great input in the healthcare setting is something we'd like to work on.
Thank you, Mr. Hunziker. I need to have you straighten me out on some of your statistics that you gave. From looking at your budget, it looks to me like you've got an $87,160,010 health care spend if you take into account all the utilization of tax money for health care issues. Is that a wrong number?
If that's taking our employee health care program, our EMS operations, our emergency medical operations, and the $24 million I mentioned here, then that's about right.
Yeah.
None of which are related to each other or funded in the same way. But, yeah.
Yeah. In all due respect, I would really consider that those are all health-oriented and health-integrated programs, and that by having that level of a spend within our community, if the information's accurate that we're hearing out of Washington on the huge trajectory upwards of costs, my figures suggest that you're not going to be looking at $87 million spend. You could be looking fairly quickly at $120 million spend. And also, were you related that that this whole problem that you're grappling with is a healthcare industry issue? I very much concur with you. I think that from my experience, when you have a healthcare problem, it's best really solved by very strong healthcare input. And I notice in the community, with your $87 million spend, you don't have a chief medical director on your staff. You don't have a formal relationship with the Medical Society for input and advice on healthcare issues. And I'm not aware of a quality assurance committee to evaluate even the evidence-based outcomes for your $87 million spend. Are those areas that you might consider accomplishing?
No. Let's get straight. $87 million they're not related. The employee health care plan is funded by the employees, and that's their health care plan. Then EMS is funded by charges to the people that EMS picks up and moves around the community. And that's completely unrelated to the health care that we provide to indigents and the jail medical. And I think it's wholly inappropriate to add those three issues together and call them the same thing. They're completely unrelated. So to say that someone would look over the three of those, no. We are very comfortable that we have a medical director that looks over EMS and the protocols that we follow in our emergency medical care program. We have in our employee health care program an award-winning program deemed to be the best health care program in the 7-county region, both public and private, in the Tampa Bay area. The best employee health care plan in the 7-county region. So we think we managed that one pretty good. What we have a problem with is $9 million that we provide for health care in this community that we provide to providers that we may not be able to provide in the future. That's our challenge. Not the quality of care, it's how we pay for the care.
Thank you. In all due respect, I do not agree with you, sir.
Well, are there further questions? Comments? I think we've had a great panel today, don't you? Thank you very much. Let's see, before we want to make sure that you know there will not be a hot topic in December, as usual, but we will begin again in January. We have 3 hot topics early in the year that I think you all will be really interested in. We hope to see you back. And then just a few things to clean up before we leave. We thank the Bradenton Women's Club for the use of their hall. We also thank METV, as always, for taping us and replaying it on their station. For the TV schedule or to watch our program online, as most of you know, go on to www.metvweb.com or use the link on our website at www.LWV, for League of Women Voters, manatee.org. The last thing I want to say is we hope that you all have a great holiday season. If any of you feel the urge to join the league, we sure hope you would do it before the end of the year. We'd be glad to have you as members. Thanks so much. Thanks again to our panel. Welcome back next year. Thanks.